Thank you very much, Mr. Chairman. My apologies to the panel. I'm not going to ask them any questions. I'm not. I think this is a really interesting discussion, but I think it's totally irrelevant to the most important discussion that's happening right now, which is not in this committee. It's not anywhere that the American public can see. It's behind closed doors where there are a certain number of Republican senators that are perpetuating a fraud on the American public. And they're not here. I mean, Democrats have been here at this hearing pretty consistently throughout the morning. Republicans have been in and out, but if you want to believe that Republicans are behind closed doors writing a health care bill that's going to steal insurance from 23 million Americans in order to pass along a tax cut to the richest amongst us, well, then this visual is evidence, potentially, of what's going on right now. And Senator Hassan has it perfect. We can talk all we want about benefit design, but if 23 million Americans lose their access to health insurance, then they can't afford prescription drugs. So it doesn't really matter what we do with respect to adjusting the intellectual property laws or trying to differently regulate PBMs. If there's a massive fall off of the number of people who have insurance, then nobody can afford the drugs that we're talking about here today. And with all due respect to the chairman, not the chairman who's sitting there today, but the chairman who made opening remarks, what does it matter that the bill was passed in 2009 in the middle of a snowstorm? What does it matter what the weather was outside? There were 25 days of debate in the United States Senate before that bill came up for a vote. The American people had a month to watch the Senate debate that piece of legislation and offer amendments. And as the ranking member said, that was on top of exhaustive committee processes. It's just not true that that bill was rammed through. That's not true. The House and the Senate debated that bill for a year and a half. It was there for the American public to see. And the reason that we are watching this process play out in secret, the reason why no one in this country will see this piece of legislation until it's already passed is because Republicans learned a lesson from 2009 and 2010, that it didn't accrue to Democrats' benefit to have that process play out over such a long period of time. So that's why they're going to keep this secret. They're going to keep it secret because inside that bill are massive giveaways for their friends. $145 billion of tax breaks for health insurers, $28 billion of tax breaks for pharmaceutical companies, $663 billion of tax cuts, almost none of which is going to anyone in this country who makes under $200,000 a year. So there's good reason why there's no Republican senators here except for Senator Cassidy. There's good reason why they're doing this behind closed doors, because it's a fraud. It is a fraud to take insurance from middle-class folks who might be struggling in this country so that you can muster up enough money to hand another big tax break to people that do not need it. I hope eventually we can sit down and have a conversation about drug pricing that is meaningful and relevant, but this isn't. This is just a distraction from what the real story is, which is this committee becoming irrelevant as a secret process unfolds to radically change 1/6 of the American economy.